Hello, welcome to this NMC OSCE tutoring video. My name is Hannah. I'm a UK registered nurse of 21 years now, just renewed my registration in January, and I'm a university lecturer, and I've been an NMC OSCE programme lead training for the NHS, and bring you lots of help and advice for those self-studying and to help you pass your OSCE exam. So today I'm going to actually show you the insulin pen. So I'm going to show you how it all works. So this is the new update that came out in January for adult and child. So the NMC are not going to be using the syringes for insulin and moving to insulin pens. So I'm going to show you quickly at the beginning how this works, what you need to do, and then I'm going to do an updated video to replace the current subcutaneous one, kind of going through the whole station. So insulin pens are great. So they're easy to use. They are a bit more comfortable for the patient. They reduce the errors as well of insulin administration. So a good and welcome change by the NMC and keeping up to date with more current practice. Okay, so I'm going to talk you through what the pen looks like and what you need to do to start with. So this is a training insulin pen. So it will look similar to this. You take the cap off here. There's no sharp here, so don't worry about that to start off with. And this vial here will be the insulin, okay? So this is where you need to confirm and check you've got the right insulin, which matches your prescription, and confirm the expiry date, okay? The rest of the pen, so you'll be familiar with pens technically. This is the dial where you set your required insulin units. And then this is the button that we press, which you see delivers the insulin units. So in terms of preparation for this, you need to, like I said, check and confirm you've got the right insulin that matches your prescription. You'll need to get an insulin needle. Okay, so they look like this. So either have paper or silver foil on the end here. You want to just pull this off. Okay, be careful, there's a needle inside there, so you don't want to be putting your fingers in there. And we're going to screw that onto the end of our insulin pen. Okay, we need to take this cap off. Okay, and we need to prime and get the pen ready. So priming is when we expel all the air out of the line. So when we dial up and give the insulin, we're giving the correct dose. Okay, so you normally prime with 2 units. Okay, so set the pen to 2 units. I'm going to take off this cap here. Now my pen's quite primed, I've been using it for teaching. But what you do with like a new pen is you're going to set that 2 units, you're going to push the button on the bottom here, and you're going to do that until you see that little dot of insulin come out. Mine squirted out quite fast because it's already primed. But you want to, that's a really important step in the insulin preparation for your pen, okay? Once you've done that, you can then dial in your prescribed amount of units. So again, you're just going to turn the dial until we get to our units. So say we've got 8 units, okay? Okay, so I've set 8 units into the pen here. In terms of administration of the insulin pen, it's the same technique. So we're still going to go in at 90 degrees, okay? We can, you can gently pinch the skin, although you don't have to pinch the skin because the needle's not as big as an insulin syringe needle, and Diabetes UK website, so you don't have to pinch the skin. But if the patient is very thin without a huge amount of subcutaneous fat, then you will need to pinch the skin a little bit. So again, you're going to pinch the skin just a little bit. I'm going to go in at 90 degrees, okay, and then I'm going to depress the plunger on the top here, and you'll hear the pen clicking, and that's the insulin being administered, and the dial will go to 0, okay. It's good to have it facing you so you can see the dial and check it's working okay. You then need to wait 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take the pen out, release the pinch, put your little bit of gauze. Okay, remember this is a sharp, so we need to dispose of the needle. The needles aren't reused, they're single use. So just unscrew it. And put it straight into your clinical waste bin. Replace your insulin cap Okay, and verbalise putting the insulin back where it is stored. Okay, so that's a little bit of practical, and now I'm going to go through the station like my other clinical skills videos to update the subcutaneous and just to break it down into that order and those key things that you need to do and verbalise. So everything else about the station remains the same. So it's still a 12-minute clinical skills station. You must read and confirm the validity of the prescription. You still need to verbalise and do all your skin checks, and you still need to prepare and administer that insulin injection pen using the correct technique, and you still need to document your medication on the administration record. So just a little bit of theory, it's so important to demonstrate your knowledge and underpinning nursing knowledge in all your stations. So just a recap here, if you can demonstrate this through this station, then it obviously really benefits you. The examiner knows you know what you're doing and you haven't just rote learnt the marking criteria. So a subcutaneous injection is when we deposit that medication under the skin into the kind of the fat layer, really, the subcutaneous tissue layer. And due to the reduced blood supply in the subcutaneous tissue, medication given this way is absorbed more slowly and over a greater period of time than if we're giving something intravenously or intramuscularly. Common uses, obviously, insulin for diabetes management. We can also give anticoagulants, so things such as heparin or enoxaparin, some hormones and fertility treatments as well. And sometimes we can give pain management through subcutaneous routes for more chronic and end-of-life palliative care pain management. So common sites are the abdomen, just avoid the immediate area around the belly button, tops of thighs, and the upper arm. And it's really important to rotate your sites and check the site for administration. If you're continuously injecting into the same area, the skin's going to become very hardened and scarring, and this will affect the medication absorption and therefore its effect. So what are the risks with this procedure? So as anything, there's infection control risks, so we need to make sure we're using a clean technique, that we're doing our hand hygiene at the correct times. There might be some pain and discomfort for patients around the injection site, and sometimes bruising and hematomas. And like I said, you can get that hardening of the skin, so that hypertrophy, which is when we have repeated injections in the same site. And with any medications, there's always that risk of allergic reactions, which is why it's really important we do that allergy check. So equipment, so like I said, you need to have a sharp spin, you'll need to get your insulin pen, you'll need some non-sterile gauze, and you'll need your insulin pen needle to attach to the end of your insulin pen. They have removed PPE from the station, but we do need to make sure we're following the correct hand hygiene moments and using a really, really clean technique with this. So scenario, medication and documentation is going to be the same. Your insulin is still going to be prescribed in units. So we might just have a simple scenario where we've been asked to administer the insulin for a patient at a set time at 12 o'clock. Remember, insulin is used in type 1 diabetes predominantly, and insulin is the key, I always call it the key that unlocks the cells to enable glucose to get into that cell so the cells can produce energy and ATP. So without that insulin production in type 1 diabetes, the glucose cannot get into the cells, and there you get all the signs and symptoms of high blood glucose. Medication chart, so normally it is a community-based prescription or a single prescription such as this. And when we're reading that prescription, we are identifying all that key information still. So the patient's details, the date, the medication and the route, and the dose and the time, the prescriber's signature and date, and prescriber's name to confirm that prescription is clear, valid and legible. So how do I break this station down? So again, key principles, this must include your ID, allergy checks and consent. So the consent is really important in all your stations, understanding what you're doing and why, and being able to explain that to the patient, including the risk, which is why that knowledge at the beginning is important. Reading your prescription and confirming it's clear, valid and legible. You're going to go and collect your equipment. You need to assess the injection site and make sure it's clean, and also rotate the injection site. You need to prepare your medication and insulin pen, and you need to administer the subcut injection using the correct technique. You need to dispose of your sharps and waste, and then you need to do your documentation on your medication administration record. And then, as with all our stations, checking the patient's okay and ending the station professionally. So starting, so key principles. You don't have to do safety every time, but if you like to do that, then do that. Safety, we want to maintain privacy and dignity because we're going to be exposing the patient for an injection. We need to decontaminate our hands using the World Health Organization 7 steps and verbalizing those. And we're going to introduce ourselves saying, using, hello, my name is Hannah and I'm the nurse working on the medical ward. I'm going to ask the patient to confirm their ID, so their name, date of birth and hospital number. I'm going to do that verbally. With the patient, I'm going to check that against the wristband and the medication record. If we're in the community, we won't have a wristband, so we're going to check that against the medication record. We need to check and ask for allergies. So again, ask the allergies and the reaction, check against the red wristband if you're in hospital and the medication chart. In the community, just check against the medication chart. Explain the procedure and gain consent. So this is where your underlying knowledge is required, yeah? So why you're needing to give the insulin, how you're going to administer it, and any risks associated with that procedure. You must ask for the latest blood glucose, okay? So this is something that's not on the marketing criteria, but it's essential. So before we give any form of insulin, we need to ensure that the blood glucose is within a safe range to give that insulin, okay? So 4 to 7 pre-meal and 5 to 9 post-meal. We want to ask where they last had the injection, okay? So we can rotate and change the sites. And we should also check that they've got food or meal prepared, okay? So after we give the insulin, patients normally should have something to eat within 20 to 30 minutes. Then we're going to read the prescription, okay? So like I said, we're going to read the full prescription, confirm it's clear, valid and legible. So I'm going to read all the patient details, the allergies. We're going to read the date, which should be day, the drug name, the dose, so how many units is prescribed, the route, which should be subcutaneous, the time, the prescriber's name, signature and date. Once we've read and validated the prescription, we can then go and get on equipment because we know what medication we need to get out. So decontaminate your hands. We're going from the patient to the equipment. So we need to do a moment of hand hygiene there. We're going to get the insulin pen. We're going to read and check the prescription and confirm the insulin in the pen matches our prescription and the expiry date. Verbalise how many units you're going to administer, which matches your prescription. You're going to need your insulin pen needle, like I showed you at the beginning, your piece of gauze, and your sharp spin. You're going to come back to the bedside. You need to decontaminate your hands because you've returned to the patient's bedside, and that's our 5 moments of hand hygiene. You need to do your second ID check because we're given a medication. So name, date of birth, and hospital number again, checking against the wristband if you're in hospital, and the medication chart. Just ask to expose the site, okay? So you should have agreed with the patient which site you are giving the medication and rotated that from the last site that they've had the insulin. You need to verbally assess the skin. So you need to assess for any signs of inflammation, infection, edema, or skin lesions and verbalise that none of those are present. And we also need to verbalise that the skin is visibly clean and we do not need to clean it with a chlorhexidine white. Okay, because we've touched the patient's skin, we need to decontaminate our hands, okay, before we start to prepare that insulin syringe. This is a really important step, especially as we are not using PPE any longer in this station. Okay, so make sure you decontaminate your hands, attach your insulin pen needle to the end of the pen, okay? As I showed at the beginning, prime the insulin pen by dialing in 2 units, hold it vertically, press the button until you see a little bubble of insulin come out of the top. Once that syringe is primed, you can then dial in your prescribed dose of insulin. Remember, you do not resheath that insulin syringe or that insulin pen, and you do not put it down once the needle is off. So once you start to prepare that pen, you need to make sure you've done everything, okay, that you've read your prescription, you've done your second ID check, you've decontaminated your hands, because you can't put that pen down once the needle is off the top. Okay, then you're going to administer your insulin. So like I showed you at the beginning, you can do a slight pinch. You don't need to do a really big pinch. And some places like Diabetes UK, so you don't need to pinch necessarily. But I would do a gentle pinch. Insert the pen at 90 degrees. You're going to press the button at the end of the pen until it goes down to 0. And you'll hear it clicking through as it administers. You must wait 10 seconds before withdrawing. So count to 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You want to withdraw the needle and release the you want to withdraw the needle and release the pinch skin. And then gently unscrew the needle on the top and put that needle straight into the sharps bin. Okay, those needles are not reusable. Okay, so be really careful with that and make sure you do that straight away. You can just apply some gentle pressure with the gauze, but obviously do not massage that area. Replace the bed covers and you've finished doing the injection. So you want to decontaminate your hands, okay, and dispose of all your clinical waste. Put the cover back onto your insulin pen, so the plastic cover. And you can verbalise that's just returning that to where it is stored. You then need to do your documentation. Okay, so make sure you've done a hand hygiene before you start documenting. You need to sign, date and time your medication prescription chart. Really important. Prioritise that over just your final bits with your patient, if that makes sense. Okay, once you've completed your documentation, then you can just finish your station professionally and check the patient is comfortable, doesn't need anything, doesn't have any questions. If you're in a hospital, ensure they've got the call bell. If they're in the community, make sure they've got GP numbers and 111, NHS 111 numbers to ring. Ensure the patient has got its food on its way. If you've got the luxury of time, it's really good here just to educate the patient on signs of hypoglycemia, so low blood sugar levels. So if you've got time, do it. If you don't, it's not critical, but it does, obviously, it's a patient safety issue. So just educate them on those signs and what to do if they experience them. And then finish your station. We decontaminate your hands using your World Health Organization 7 steps. If you have remained in time on station, which you should have, just go back and double check that documentation. It's so important, often a cause of fail because we haven't put a signature or date and a time on it correctly. So my top tips for this station, so obviously don't forget your ID checks, IG checks, that's essential. You're given a medication. You must check the latest blood glucose to make sure that it is at a normal and safe level to administer insulin. You must read the full prescription, okay, including the date, time, drug, dose, route, prescriber's name and signature, and confirming that that prescription is valid, okay. Make sure you are verbalising the medication amount and the expiry date and cross-checking this with your medication chart. So look at that pen, look at the vial and verbalise that, okay? Ensure you are rotating the injection site, so asking the patient when they last had the insulin injection and rotating that site. Ensure you are checking that the skin is clean and assessing for any signs of infection, inflammation, edema or skin lesions. Don't forget to prime the insulin pen, okay? And do not resheath or recap the insulin pen. You want to obviously immediately administer it, and once it is primed, make sure you're using the correct technique, which is the 90 degrees and waiting for 10 seconds. Make sure you unscrew that pen, the needle off the top of the pen and put that straight into the sharps pin. And don't forget to do all your documentation on your medication chart. Hope that's helpful for you. I do one-to-one OSCE tutoring and I get really booked up in advance now, so I'm incredibly busy. But please give me an email if I can support you at all. I do full packages online, in person, mixed online and in person, and just single sessions if you're doing self-review and study. Just want to ask some questions or practice some specific stations, please feel free to contact me on hannah.ames@outlook.com.